Good evening, everyone. My name is Khaira. I am from Khaira Education Private Limited. We are Asia's first premium preparation provider, and I'll be taking a class on OET Speaking today. While we're waiting for others to join in, I'd like you to tell me where you're from and which version of the OET you're preparing for. Just give me a minute while I wait for my chat to load. Hello, Ayaz. Hi, Samana, Lisha, Christy. Hi, Salma. Hello, Isabella. Good to see you, Atvinder. Please tell me which part of the world you're joining from and which version of the OET you're preparing for. So if you're a nurse, please write nursing next to your location. If you're a doctor, please write medicine and so on. Hi, Susan. Hi, Ahmed. Hello, Christina. Okay. Thank you. Thank you for answering this question. Hi, Leta. All right, great. Let me just share my screen. This is our topic for today's class, persuading patients to achieve concordance. Now, I'd like you to tell me, what does the word persuasion mean to you? While we're waiting for others to join in, let's talk a little bit about today's topic. Please type in your answers. What does the word persuasion mean to you? What is your definition of the word persuade, persuasion? Hi, Anusha. Hello, Ramzana. Convince, yes. Quankamore, that's right, convince, convincing. Excellent. Yes, Pete, that's correct. Convincing someone, inducing somebody to do something by discussion or by reasoning. And what do you think concordance means? Convincing patients or persuading patients to achieve concordance. What do you think concordance means here in this context? That's right, Abdul, like convincing, good. Agreement, excellent, Deep, yes, agreement. So concordance is agreement. So today's topic is about persuading patients, or in other words, convincing patients how to agree with you. And agree for what? Agree for treatment options, when you're advising them on treatment options, which could be about taking medication, it could be about lifestyle modification, anything that's a part of the treatment plan. And why is it important for your OET speaking preparation? How is it relevant? You must have come across cue cards in which the patient is resistant to your advice or is reluctant. And this strategy will help you to change the patient's existing stance. That's why it's important. All right. I want you to look at this medical scenario. I'm going to give you about 1 minute to read this. This is a medical scenario for a resistant patient. I want you to read this and then we shall discuss. Imagine that you're speaking to a middle-aged patient who has been referred to you for advice on weight loss. The patient is overweight and needs to lose weight to improve his or her general health status. She has a demanding corporate job with long sitting hours. The patient rarely finds time to exercise, relies on takeout meals, and binge eats to cope with stress. The patient has a hectic lifestyle, is reluctant to join a gym or find time during the day because of busy routine for physical activity. In the past, the patient has tried different weight loss programs but has not been able to cope, obviously because of the different demands he or she has on uh, their routine. So what I would like you to do is, I'm going to give you two different approaches. Then we shall discuss which is the right approach to convince this patient to comply with your advice. Let's look at approach number one. All right, this is our approach number one. Let's call it the shot put approach, metaphorically. So just like in a game of shot put, there's a heavy ball, metal ball, which the sportsman has to throw as far as possible, and that's the measure of success. In this case, the core idea of this approach is that deliver a well-argued, a well-reasoned, a well-conceived message to the patient, and that's perceived to be the end of communication. That as long as the message is well formulated, it has a reason and it's got a good argument in it, deliver it to the patient, and that's it. Consider the communication job done. So in this case, the patient's viewpoint, or in other words, how the patient feels towards your advice, this is not considered important in this. Let's look at an example for this approach. So this is an example for the short put approach. It's good that you're so dedicated towards work. This tells me that you know how to work hard to achieve goals for yourself. I don't see a reason why you won't be able to do this too. I'm afraid you don't have a choice anymore. Your weight is alarming and you're putting yourself at risk for problems like diabetes or heart disease if you don't start making committed efforts towards losing weight. So in this case, the message is well formulated, well reasoned, well conceived, and it's delivered to the patient, but it's not the patient's reaction is not sought. The patient's viewpoint, how he or she feels towards this, it's not considered important. The emphasis is that just deliver a well-reasoned message to the patient. This is the first approach. Now look at approach number two, and let's call it frisbee approach. So just like in a game of frisbee, there's a disc that we throw to a partner, and then the partner throws it back to us for us to catch it. In this, there is information exchange between the health professional and the patient. So the central idea of this approach is that just giving information to the patient is not enough. It's also important that the patient is asked how they feel about what you're proposing, what you're suggesting. And responding to that is very important. By doing all this, we will be able to establish a mutually acceptable plan, something that works for the patient, something that they would be comfortable and happy to comply with, and something that the health professional would be happy with, so that the patient's health is not put at risk. So while in the first approach, the short put approach, the focus was on delivery of the message. In the frisbee approach, the focus or the emphasis is on interaction, encouraging interaction between the health professional and the patient, then seeking the patient's opinion, how do they feel about it, eliciting their reaction, and collaboration, arriving at a plan that suits both the health professional and the patient. Let us look at an example for the Frisbee approach now. I understand what you're saying. My concern is that the excess weight can cause health problems, and it'll be wise to think of ways we can address this to avoid any complications in the long run. It's good that you're so dedicated towards work. This tells me that you know how to work hard to achieve goals for yourself. Let's start by setting small weekly goals that you feel are achievable for you. I know that you're struggling with time management, so we can discuss ways you can work physical activity into your routine. How do you feel about this? So in this case, the doctor or the health professional is seeking the patient's opinion that, okay, if you're struggling with time management, how about we find a way that you can incorporate physical activity into your routine by different ways, which could be by taking the stairs or exploring different ways where a patient does not have to take out time separately, and then seeking the patient's opinion at the end that how do you feel about this? So this would be the Frisbee approach. Now, I have a question for all of you. We've discussed two approaches for the medical scenario that we looked at, the shot put and the Frisbee. I would like you to answer, in your opinion, which approach would be better to promote compliance with the recommended advice? Which approach would you adopt as a health professional if you want to promote compliance or adherence to the recommended advice? Please type in your answers. Beatrice says Frisbee. Excellent. Yes, Reena. Ayaz says Frisbee. Great. Yes, Abdul, that's correct. Fantastic. Irene says Frisbee. Good, Gracie. Wonderful. So all of you agree that this second approach, the Frisbee approach, is better. Let's discuss why this is better. Two main reasons. Two reasons why the second approach is better. It's more interactional in nature. So the patient is involved in all stages of the decision-making process. So when you are giving a suggestion, then you seek their opinion. If the patient has concerns, they can be addressed right there and then. The patient can open up about what they are comfortable with, what they will not like to do. And at the same time, the health professional can also open up about their own dilemmas. So they can explain to the patient why something is not advantageous to their health. They can explain the risks associated with continuing with some bad habit that puts their health at risk. So this is more interactional in nature. And because it's interactional and the concerns that are discovered from the patient side are addressed right there and then, and they can be addressed by making minor modifications, minor adjustments to the treatment advice without putting the patient's health at risk, the compliance is likely to be higher with this approach. So it's always better to adopt this approach when you're trying to persuade patients rather than forcing them to do something, rather than saying that this is the only choice you have. It's better to use Frisbee, or the name that I would like to give this is shared decision making. The decision making is a shared process, collaborative process between the patient and the health professional. So we're going to call this concordance-based approach. And concordance is agreement. And for purposes of OET speaking, I would say concordance is an agreement that respects the wishes of your patient. So this is the strategy that I would like to discuss for your OET speaking. Whenever your patients are resistant or reluctant to advise, use this strategy, which we will discuss in this class today, concordance-based approach. And the underlying concept for this is, the central idea for this is that the decision making has to be shared. Now, what I have done is, I have designed a framework, a step-by-step approach for this strategy. And there are 4 main steps for this. The first one is make suggestions. This is the first step of this strategy. The second is elicit reactions. The third is negotiate. And fourth, and the final step is clarify what the patient is happy with and what the patient is willing to do and has understood from this discussion. So now we're going to look at each step in detail. Now I have another question for you. I want you to read these 2 statements and answer the question. Which is a better way to offer suggestions to patient? Is it the statement on the left or the right? I'll give you about a minute to read both, and then please type in your answers. Which one do you think is a better way to offer suggestions to patients? LJ says right. Great. Sean says right. Very good. Chara says right as well. Irene says the right side. Mike says the second one. Great. I'm so happy to see that all of you agree that the example on the right is a better way to give advice. Yes. All right. Coming to this first step of our strategy. Offer suggestions, not instructions. Often patients respond better to suggestions rather than something that sounds commanding or authoritative. It's not a good idea to make it sound like a directive that you must do this. It has to be done. Rather than that, a better approach is to make it sound like a suggestion, something that they will respond better to. Sounds polite, and it also gives them, it makes them feel that they are empowered. It gives them the autonomy to take their own decisions and makes them feel responsible for their choices. So rather than telling somebody that they need to do something, it's better to transform that into a suggestion. And the technique for doing that is indirect language, by using indirect language. Now, what does this mean? Indirect language means prefixing a softener phrase to your advice so that it sounds like a suggestion. It sounds more courteous, sounds more polite for the patient. For example, I could say, you must do your homework by tomorrow. You must complete this work by tomorrow. Or I could say, could you try to do this by tomorrow, please? Which one sounds more polite out of the 2 the two sentences, the two examples that I used, which one sounds more polite? The first one or the second one? Second one, yes. Good, Deepthi. Sounds more polite, more courteous, more respectful. So this is the technique. We use indirect language to add some softeners, some softening phrases. And this tentative language, it can be like adding a phrase like, I'm wondering if you can do this. I'm wondering if you can increase physical activity in your diet. I'm wondering if you can start setting alarms if you are missing out the right time to take medication. Or you can use modal verbs. This might be beneficial if you can increase your water intake to remain hydrated. Would you please try to quit smoking? Would you try to increase fiber intake in your diet? So this is a better way to give suggestions. Whenever you want to give treatment advice, when you want to advise patients on what to do, which is a part of the treatment plan, it's better to use indirect language to give suggestions. Let's look at the same example, the one in the right-hand column that we looked at. If you're unable to take out time to exercise, I'm wondering if you can think of some ways to introduce physical activity in your routine. So rather than saying you need to increase physical activity in your routine, this has been transformed using indirect language. I'm wondering if you can do this. I'm wondering if you can think of ways to introduce physical activity in your routine. Why don't you consider walking or cycling to work instead of taking your car? Compare this to something like you you can start walking or cycling rather than taking the car to your work. Compare this to that. Why don't you start doing this? There's a very small difference, but then it makes the meaning, the subtle change in meaning and the connotation, I think it makes all the difference as a patient. If you put yourself in the patient's shoes, then this approach, using tentative language, using indirect language, sounds politer. You could also try to take the stairs instead of the elevator. Does this seem manageable? All right, I have an activity for all of you. There are two sentences that you see on the screen. These are very direct. They come off as commands, come off as directives. So what you need to do is either using some softener phrases or modal verbs based on the example that we looked at. I want you to transform these and make them more polite. Use indirect language to make them more polite and make them more appropriate. Make them sound like suggestions rather than something that the patient must do. Type in your answers for the first one, please. You need to stop smoking. Comes across as a command. How can we make this more polite? Would you try to quit smoking? Excellent. Would you please try to quit smoking? Very good, Deepthi. It would be beneficial if you can stop smoking. Very good, Ahmed. Very good. It'll be good for you if you stop smoking. Well done, Anil. I'm wondering if you could cut down on your smoking. Okay, I'm wondering if you can quit smoking. I'm wondering if you can try to stop smoking. Excellent, Shiba. I'm wondering if you can stop smoking. Fantastic. Great, great. We've seen some great examples for the first one. How about the second one? You must cut down on salty and fat-rich foods. Can you transform this, please? Use indirect language to transform this. Well done, Khaira. That's good, Spira. Good. So LJ says, I'm wondering if you can try to eat healthy by cutting down salty and fatty foods. Do you think you can do that? Excellent. Can you reduce salty and fat-rich food intake? Good, Beatrice. It would be great for your health if you can cut down on salty and fat-rich foods. Very good, Jaja. Could you please cut down on salty and fat-rich foods? Great, Alok. Giselle, that's a good response. Well done. Nguyen, Sanoj, Anil, all very good responses. Reena, that's a great response. Lanaya, well done. That's good, Deepti. All right, great. All of you submitted some great responses. I'm happy. So this was our first step. To persuade patients, whenever you want to advise them, use indirect language. And we can do that by using tentative language. The second step is elicit reactions. Elicit reactions from the patient. What does the word elicit mean to you? What do you think? What is your definition of the word elicit? Please type in your answers in the chat box. Obtain. Okay, Reena, that's good. Okay. So the word elicit means draw out something, extract something. So in this case, this step involves asking the patient's reaction, asking them about how they feel. The health professional can actively encourage the patient to contribute their ideas and suggestions about what you're proposing. If you're giving them advice on something, if you're proposing something, giving them a suggestion, whether it's about treatment or about some lifestyle modification, after giving that suggestion, ask them, how do you feel about this? What are your thoughts about this? And it is very important for the health professional to demonstrate a keen interest, that they're attentive and they're interested in knowing about the patient's perspective. Because if the patient somehow is not asked directly, if they are reserved, they're introverted, or if they don't feel comfortable to share their concerns or reservations, if they have any, they might not speak up during the consultation, but the compliance with the recommended plan in that case would suffer. There might be poor compliance. So the right step is to ask the patients directly. They should be asked directly, how do you feel about this, what I'm proposing? And let's look at some language examples by which you can do this. So these are some examples using which you can seek out or elicit the patient's reaction or perspective. What are your thoughts about what I suggested? Is this something that you'd be able to do? Does this sound plausible? Or does this sound acceptable? Do you think this is manageable for you? How do you feel about this? What are your thoughts about this? Do you think this is an achievable target? Can I check if this plan suits you? Can I check if you're happy about what I'm saying? So these are some examples you can use. Either of these, of course, this list isn't exhaustive, just some examples using which you can check the patient's perspective, their thoughts, their feelings, their ideas about how they feel towards your advice. So we've discussed step 1 and step 2. Step 1 is that you offer suggestions rather than sounding authoritative or commanding. Step 2 is when you've given a suggestion, when you've suggested something to the patient, always check how they feel about it. Check their perspective by asking directly. Now let's see an example how this can be done. I'd give you about a minute to read this dialogue between a patient and a health professional. So in this case, the health professional is speaking to a patient who has been diagnosed with fatty liver. And the treatment the treatment plan is that the patient needs to stop consumption of alcohol from that point on. So look at how the doctor, the health professional, gives advice. Could you try to avoid any alcoholic drinks entirely until the condition is resolved? Made it sound like a suggestion. Let's say about 3 to 4 months. Do you think you'd be able to do that? Now, in this case, the patient's response is that the patient is not too happy with this advice. The patient says that, oh, is there an alternative? Because wine helps me take this day's stress off. So how do we respond? How do we respond in such cases? What is the right way? What's the appropriate way to respond when a patient has reservations to your advice? What do you think is the right way to respond in this case? What would you say if you were the health professional and the patient says this? How would you respond to this? I do understand your situation. Okay, that's good, Anita. I understand your concern. All right. I understand it might be difficult for you, but very good. Excellent, Ahmed. Good, Fatima. I understand your concern. Your concerns are understandable. Well done. I understand your viewpoint. I understand your view. Good, Beatrice. I understand your perspective. Okay, Farah. Great, great. Good responses. All right, let's discuss some strategies that will be useful for you at this stage. If a patient has some reservations, they have some concerns to what you're proposing, it would be helpful to, number one, remain non-judgmental. Now, what I would like you to do is look at these two statements and tell me which one sounds better. And if you make a choice, please add a rationale as well. Tell me why you are choosing this and why this sounds better. What do you think is the difference between these two statements, and which one sounds better and why? The second one sounds better, Giselle. And why do you think so, Giselle? Good, Romulan. What is the difference between the first and the second statement? The one on the left and on the right. What do you think is the difference between these two? Great. I see all of you feel the second one, the right statement, is better. Okay. So if you look at the statement on the left, it's a bad idea. It's a bad idea for you to eat sweets with your current weight. It has a hint of judgment. It's slightly judgmental towards the patient. Whereas the second one is devoid of any judgment. It's simply giving advice to the patient, but there's no judgment there. So whenever the patient shares any concern or any thoughts with you, and during the consultation, the purpose of eliciting their reaction is to encourage them to open up about how they feel, about their thoughts, about their notions. And when they do, your job is to remain impartial. You should not negatively evaluate or their opinion or their lifestyle choice. Your job is to assist them to manage their health. Your job is not to approve or disapprove of their lifestyle choices. So this is the first strategy that I want you to remember. Whenever a patient shares a concern with you, remain non-judgmental at all times. The best way, if a patient shares something with you that you don't agree with, that you disagree with, the best response in those situations is just accepting that viewpoint. That, okay, I understand. It's fine. Right. That's the best response. Accepting their views and the legitimacy of their views, because they can have an opinion. You should not be having any negative opinion or negative evaluation of their opinion. Then there are two other strategies, two other skills that you should incorporate when a patient responds with some concerns, when a patient comes back with some reservation about what you're proposing. First one is validating their perspective. To validate it means that you show your understanding, you convey your understanding of the patient's feelings. In other words, empathy. Now, I was noticing the responses all of you shared. I understand. I understand it's difficult for you. Your concerns are understandable. All of these examples, they validate the patient's viewpoint. So this is a good way to make the patient feel supported. It's a good way to make the patient feel comfortable. And this will eventually help in building up a plan or reaching a consensus, because the patient will feel understood. So let's look at an example on the screen. I understand what you're saying. It's challenging to make sudden changes to lifestyle. This is an example to validate the patient's viewpoint. So for example, if you would suggest the patient to cut down on something, cut a habit out of their life, kick a habit out of their life suddenly, the patient says, oh, I don't think I'll be able to do that. It's too sudden. Then a good way to respond at that time is a non-judgmental response, and to use words that will validate their viewpoint, that will convey empathy. That, okay, I understand what you're saying. Doing this won't be easy. It's never easy to make sudden changes to your lifestyle. Then the second strategy, the second skill is using normalizing statements to reassure the patient. And the purpose of normalizing statements is to normalize the situation for them. So that, again, the patients can be put at ease. They feel comfortable in opening up to you. And the purpose of normalizing statements is to show the patient that whatever they're feeling is normal and is to be accepted. So for example, if a patient says, I feel really guilty. I've not been able to lose weight. What do? I feel so guilty. It's okay to feel this way. It's normal to feel this way. Many patients feel this way. This is an example of normalizing statement. So this puts your patient at ease, and it can also reassure the patient that they're not alone. There are others in that situation. Now let's see how we can use these three important aspects that we discussed: remaining non-judgmental, using validating statement, and using normalizing statements. Let's see how we can use them for the same example that we looked at, in which the patient was diagnosed with fatty liver. So I want you to see the last part of this conversation. The health professional responds by saying, I understand what you're saying. I know this isn't easy. But right now, the goal is to reverse damage done to the liver. And I'm afraid any further consumption would make it worse. Abstinence for 6 to 8 weeks should usually resolve the condition. And at that time, we can revisit whether it's safe for you to consume wine again. How do you feel about this? So in this case, there is no judgment from the health professional side. The health professional responds with an empathetic statement that I understand what you're saying. It's not going to be easy, but then also uses a normalizing statement that abstinence for 6 to 8 weeks or that refraining from alcohol for 6 to 8 weeks will usually resolve the condition. And at that time, at which time it can be discussed again. This plan can be revisited again. So this is how you should respond when a patient comes back with a concern. So far we have discussed the first two steps for persuading patients: offer suggestions and elicit their reactions. And if the patient is concerned, if the patient has some concerns, you remain non-judgmental. You respond with an empathetic statement and you try to reassure them by using a normalizing statement. Let's come to step number 3. But before I discuss this, I will give you a minute to reflect on what we've learned so far and ask me any questions if you have. If there are any questions, please type them in the chat box. All right, moving forward, let's come to step number 3 now, negotiation. Now, the meaning of the word negotiation is reaching an agreement, possibly with minor adjustment. So how we can do this? The first step is when you're trying to convince the patient to highlight the risks associated with non-compliance and also emphasize the benefits of what you're proposing. And if the patient is still resistant to that advice, without putting the patient's health at risk, make minor adjustments, offer them some alternative, something that will be okay for them, something that helps you find a middle ground. This is the technique of negotiation. So you can make minor adjustments, you can tweak your advice slightly. Just remember that this should not put your patient's health at risk without compromising their health status in any way. Tweak your advice and check with them if they're happy with that plan. Let's look at an example for this. I'd give you a minute to read this dialogue. This is a conversation between a health professional and a patient who's reluctant to cease smoking. All right, let's discuss. So in this case, we see a dialogue between a health professional and a patient who's reluctant to give up smoking and insists on an alternative. So the health professional starts by saying, I do have some reservations about taking the approach that you suggest. Can I explain them to you and perhaps we can try and find a solution that works for both of us? Now, by doing this, it helps in demonstrating a respectful attitude towards the patient, seeking their permission before moving forward. Then the health professional proceeds by saying, in this instance, and from a medical standpoint, I personally want you to consider the risks associated with continuing to smoke. Consider the risks associated with highlighting the disadvantages if the patient continues to smoke. I think, given the very strong history of heart disease in your family and the effect that smoking has in your risk equation, it would be best that we cut down on the number of cigarettes you smoke per day if you cannot cut it out altogether. Look at this phrase, it would be best. This technique is called labeling, emphasizing or highlighting your advice by using words like it would be best. It is very important. It is crucial. So this technique, when you attach significance to your advice, this is called labeling. This is very useful when you're trying to convince the patients during the negotiation step. Then see the part where negotiation happens. The patient is insisting that I cannot cut down on smoking. So I cannot cut out smoking. So the health professional suggests that, okay, if you can't cut it out altogether, if you don't want to stop altogether, how about you cut down on the number of cigarettes? How about you reduce the number of cigarettes that you smoke? So this is where minor adjustment has taken place. The advice by the health professional has been tweaked slightly without putting the patient's health at risk so that the patient is comfortable with this plan. And then the final step is, does this sound like a realistic target to you? Checking the patient's perspective about your advice. So this is our step. This is the negotiation step. We highlight, we talk about the risks associated with not doing what you're suggesting, using labeling to highlight or emphasize the importance of your advice, making a minor adjustment or giving them an alternative that they'll be happy with, and finally asking them, eliciting their reaction. How do you feel about this? Let's look at another example, and then we can identify examples together. So in this case, you see a dialogue between a health professional and a patient named Mary. This is from a follow-up visit. Mary was prescribed a course of antibiotics during her last visit for a viral infection. All right, let's discuss. So in this case, Mary fails to comply with the recommended treatment plan. She comes back for a follow-up visit. But when the doctor asks her whether she has completed the course of antibiotics that was prescribed, Mary says that no, it made me drowsy at work. And that's why I stopped it. I discontinued it, did not complete it. Notice how the health professional responds. A non-judgmental approach, right? Rather than judging the patient, like in this case, there could have been a negative evaluation as well, that that's bad, or you must have not done that. Those are wrong examples. That would have been a judgmental approach. So just see how the health professional responds, right? Then mentioning the disadvantages of this step, discontinuing the medication. I'm afraid the drawback of discontinuing your medication is that the infection persists. Then using labeling to highlight the importance of completing the course. Completing the course is crucial to get rid of the infection. Otherwise, it will most likely just drag on. Again, highlighting the risks. That said, if it makes you drowsy, I can write a note to help you take some time off work and rest until the infection clears up. How does that sound? Look at the part where negotiation happens. So the patient initially shared concerns that the medication made her drowsy. That's why she discontinued the medication. So an alternative that the doctor offers, the health professional offers in this case, is that, okay, how about you complete the course, and to help you, I can write a doctor's note that can help you take some time off work. And then checking the patient's reaction. How does that sound? So this is how negotiation is done to convince patients, to persuade them. Then after the patient has agreed with you, once the patient agrees with and you're able to arrive or reach a consensus, something that both the health professional and the patient is happy with, then it's a good idea to confirm with the patient whether or not they're happy with that plan. Just final check. Can I check if you're happy with this plan? An alternative approach can be using the teach-back method. So teach-back method is where you ask the patient to repeat what they have understood or what you have discussed during the consultation. So ask the patient to summarize the plan of action that you've agreed on to ensure that he or she understands what's expected to be done. Now, if you're happy with the plan, can you recap what we've discussed about your treatment plan? Or just to make sure that you've understood everything correctly, can you please repeat what we've discussed about your treatment plan? So this is our final step. All right, a quick revision of what we've learned today. To persuade patients, you have to follow 4 steps. First is offer suggestions rather than being commanding. Rather than giving direct instructions, use tentative language or use indirect language to make them sound polite, to make them sound like they're suggestions only, merely suggestions. The second step, elicit the patient's reaction. Keep checking with them. How are they finding your suggestions? Constantly, at each stage, that how do you feel about this? What are your thoughts on this? Do you think they'll be manageable for you? When the patient shares their concerns with you, remember that you have to be non-judgmental, completely impartial. Your responses should be devoid of any judgment. You can use empathy at that stage to validate the patient's viewpoint. You can also use normalizing statements to reassure the patient. Finally, when you come to negotiation, don't forget to highlight the benefits of your advice. You can use this by using the technique called labeling. You can also highlight the risks associated with non-compliance. You can discuss how the patient's approach can put their health at risk, how this can be disadvantageous or harmful for their health. And if needed, minor adjustments can be made without putting their health at risk. And finally, once you have reached a consensus and agreement has been reached, then check with the patient if they're happy with that plan, or a better way to do this would be using the teach back method. Ask them to repeat. What are they going to do? What are the steps of the treatment plan? What does the treatment plan entail? So this is our lesson for today. I would like you to ask me any questions that you have about this class. If you have any questions, please type it in the chat box. So Jency is asking, can we use need to? Jency, I think you mean using need to when you're giving suggestions to the patient, right? I think it would be better to use tentative language that this might be beneficial for you. This would be a good idea if you can do this. So we are trying to make it as polite as possible. Because it's commonly believed that people respond better to suggestions rather than being told what to do. So we're looking at language that makes it sound like a recommendation rather than an instruction. Thank you, Giselle. Thanks, Shiva. Thank you, Brenda. All right, if there are no further questions, thank you so much for attending the class today. I hope you enjoyed it, and all the best for your OET exam.